So, good morning, everyone. Thank you for the introduction and thank you for giving me the opportunity to present my work about the characterization of aortic blood flow in aortic dilation. Okay, so as you know, the aorta has a natural trend to dilate with age. But when this dilation exceeds 40 millimeters, it is pathological. And when it exceeds 55 millimeters, that leads to a surgery to avoid aortic dissection. However, some studies have shown that the use of the diameter as the only parameters was not efficient for 20 to 40% of patients with an aortic dilation. Based on this fact, we wonder what if the solution was not to add some hemodynamic information to the morphological information. Thus, the aim of our study was to design flow disorganization quantitative indices and evaluate their added value in patients with aortic dilation. To achieve this goal, we had 56 healthy volunteers as well as 20 patients with a dilation of the ascending aorta and the tricuspid valve. Because we wanted to also study the effect of both aging and pathological dilation, we have divided our control group into two subgroups, age under and above 50 years. Regarding our dilated group, as you can see, it is interesting to note that there is no statistical difference between this group and the other group in terms of age, systolic blood pressure, and body surface area. Just briefly, all our patients underwent a 4D-floor MRI as well as a SPGR MRI, and you can see here the following acquisition parameter. So what was our study workflow? So we have used the SPGR data which have a good anatomical resolution to compute some geometrical indices, just like diameter. Then we have used the 4D flow MRI data to segment the aorta and isolate the blood flow. And we have divided the aorta into three segments: the ascending aorta, the arch, and the descending aorta. Each segment was subdivided each 5 millimeters into region of interest. And from this region of interest, we have extracted two main parameters. The first one are the eccentricity, which is a measurement of the maximum jet flow displacement from the center on the aorta. The second one is its angulation. And these two parameters has been computed on the systolic phases. In the second time, we have extracted the net, the forward, and the backward flow from each region of interest. Then we have computed its peak and its volume computed as the area under the flow curve. Finally, to not be too correlate with the diameter, we have normalized them. So let's go to the results. So here you can see the box plot for each groups and each part of the aorta of the angulation and the eccentricity. And as you can see here, the main result is that they are significantly higher in the ascending aorta, which reflecting the flow disorganization that can be seen on the 4D-floor MRI data. Of note, it tends to be reduced when you move away from the dilation area, namely the ascending aorta. Now you can see the volume of backward and net flow. The first result is that there is no statistical difference between our dilated patient here in orange and our group of control. And that means that whatever the dilation, the same amount of flow reach the peripheral organs, which is consistent with physiology. Our second result is that the volume of backward flow increased by more than 500%, contrary to the diameter, which only increased of 50% in the same time. So the volume of backward flow could be used for a better stratification of the dilated patient. And finally, this increase is significant both in terms of aging and dilation in the three parts of the aorta. Finally, we wanted to check that this increase of volume of backward flow was not just due to the fact that the aorta was bigger and so the amount of flow was higher. So we have also studied the normalized parameters. And as you can see, it remains significant in the ascending aorta and the aortic arch. So finally, we wanted to check the ability of our flow indices to characterize the aortic dilation. And here you can see each flow indices for each part of the aorta and the result for our ROC analysis. So now you can see on your right the ROC analysis curve for the volume of backward flow, which have shown the best results in terms of area under the curve and accuracy. So to conclude, we achieved the aim of our study since we have shown a significant variation of flow indices in both aging and dilation. And we also have shown their ability to characterize dilation. So now, what is the next step of this work? The first one is to use this parameter to do a local mapping, and so be able to do a more accurate detection of area at risk to prevent dissection. The second part of his work is to do a multi-parametric characterization. Just for example, we have computed and studied the threshold variation with a leave one out approach, as well as we have studied the redundancy of our parameters in addition to our ROC analysis. And you can see here two flow indices, namely the normalized peak and the volume of backward flow in addition to diameter. And as you can see, we can draw a hyperplane to well separate our control from our patient. Now we need to apply this work with longitudinal data to validate our hypothesis. So finally, I would like to thank my colleague and my co-authors, and I thank you for your attention. And please feel free to ask any questions.